Hi, this is my physical assessment of a 26-year-old female. Hi, how are you today?
Good, how are you?
Good. Can you give me your name and date of birth?
Sam 7799
And can you tell me where we are today?
at my doctor's office,
And what's today's date?
June 22nd.
So, just upon general inspection, the patient appears appropriate for her gender and her age. She's alert and oriented, person, place, time, and situation. She's well kept. She's dressed appropriately for the season and the weather. Her posture is upright. Her breathing's non-labored. And overall, she's alert and responsive, calm, and appropriate for the situation. I'm going to proceed with skin, hair, and nails assessment. So just on inspection, the color of her skin appears appropriate for her ethnicity. There's no pallor or jaundice. It's warm and dry and even to the touch bilaterally. Hair is evenly distributed across the body. There's no obvious scarring or lesions or masses. There's no moles or nevi or any lesions that would require an ABCDE assessment. The scalp is rounded, and upon inspection it's smooth. There's no masses or deformities. Her nails are shaped evenly. There's no bumps, there's no clubbing. Her nails are painted, but if I were to assess cap refill, I would squeeze them, and a normal cap refill would be under 2 seconds. So for her head, face, neck, eyes, and sinuses, the head appears normal, cephalic, and atraumatic. There's no deformities. Her face is symmetrical. I'm going to look at her eyes. So the sclera are white, and the conjunctiva, I'm going to pull down the lower eyelid. The conjunctiva are pink and moist. There's no redness. There's no jaundice or purulence. The pupils with the light I can see are equal, round, reactive to light, and accommodation. Going down the neck, the carotid pulses are 2+ and equal bilaterally. I can auscultate the carotid pulse and check for presence of the pulse and make sure there's no bruit. The trachea is midline, there's no deviation. If I were to assess the patient's thyroid, I would stand behind her and I would hold my hands here and ask the patient to swallow. She would swallow, and the thyroid would be not enlarged. It would move with swallowing, and it would be non-tender to palpation. The maxillary and frontal sinuses are also non-tender to palpation. Moving on to eyes, ears, nose, and throat. So with a little light, I would check the nasal mucosa. It's pink. There's no drainage or discharge. The septum is midline, and there are no obvious deformities. I would, if you can open your mouth. The oral pharynx is pink and moist. There's no ulcers or lesions on the soft palate, the hard palate, or the tongue. The lips appear pink and smooth. There's no lesions. The gums are also firm without any bleeding. She has good dentition. The tonsils were present. They were pink. There was no erythema, purulence, or any type of swelling in the throat. The uvula was also midline. I would move to the lymph nodes, down the neck. They are non-palpable and non-tender. Moving on to respiratory exam. So just upon inspection, she has unlabored breathing. It's quiet, there's no distress. It looks like she has even rise of the chest bilaterally. I would listen to the lungs with my stethoscope. I would listen anteriorly and posteriorly to the lungs in several places, checking both lungs and all the lobes. and they are clear to auscultation. I don't appreciate any adventitious breath sounds. There's no rhonchi, wails, wheezing, or crackles. I palpate palpate the rib cage. There's no tenderness, and there's no crepitus. Chest expansion is symmetrical. Moving on to the cardiovascular system. The heart is auscultated at the 5th intercostal space on the left of the midclavicular line. So I would listen to that. And I hear S1 and S2. I do not appreciate any extra heart sounds. There's no murmurs, gallops, or rubs. Carotid auscultation, there's no bruit. I would palpate all of the pulses. So radial palpation, 2+ equal bilaterally. Brachial, 2+ equal bilaterally. Femoral, right here, equal bilaterally, 2+. Popliteal, behind the knees, equal 2+ bilaterally. Dorsalis pedis on top of the feet, 2+ and equal bilaterally. And posterior tibial as well, equal bilaterally, 2+. I don't appreciate any edema. I would say 1+ on the lower extremities, but there's no other edema appreciated in general in the rest of the body. Okay, so I will just verbalize a normal female breast exam. There are different positions in which they can be examined. Usually the patient is lying down. The patient can also be standing with hips at the sides or leaning forward as well. So I'm just going to verbalize a female breast exam. This can be done in different positions. The patient can be lying down, standing with hips at the sides, or leaning forward. So the breasts should appear firm and smooth, round. They can be slightly asymmetric, that's normal, but there shouldn't be any dimpling, flattening, or retraction. There should be no lumps or masses palpated, no warmth, edema, erythema palpated either. The patient can put their arms overhead for you to palpate the tail of Spence, and while you're palpating, you should be doing it in a vertical stripe method. To assess the nipples, there should be a normal color. Asymmetry is normal. They can be either inverted or everted, and there should be no discharge on palpation. Okay, we're going to continue to abdominal exam. So I'm going to have the patient lie down, flat. So just upon inspection, first, the abdomen appears flat. There are no obvious masses or bulging or pulsations appreciated. There's no distension. So the abdomen appears symmetrical and flat. The umbilical hernia is also flat and central to the abdomen. I don't see any pulsations. First is auscultation. So I would auscultate all 4 quadrants of the abdomen. 1, 2, 3, 4. Bowel sounds are normal active. Percussion is next. So I hear tympanic sounds over most of the abdomen, but there is a dullness that's heard over the spleen and over the liver. Palpation is next. The abdomen is soft, non-tender to palpation. I can feel the edge of the liver, it's non-tender. I'm not able to palpate the spleen, and I'm not able to palpate the kidneys. You can also listen for the femoral artery. There should be no bruits. Okay, you can sit up. I'm going to just verbalize a normal female genital exam. The labia should appear symmetrical. There should be no swelling, no lesions, no masses. It should be normal color for ethnicity. The urethral meatus should be present, and at the midline there should be no redness, irritation, or discharge. Okay, the musculoskeletal system. This is going to check for strength, so turn your head to the right and to the left, and then I'm going to have you take my hands and push up against my hands. Now pull them towards you. Okay. Push up against my hands and resist me pushing down. Okay, so patient has equal bilateral strength, 5 out of 5, with both upper, lower extremities and head and neck. Her posture is upright and appropriate. I'm going to have you stand up. I'm just going to do a spine inspection and palpation. The spine is symmetrical and there's normal curves. The cervical curve is present, the thoracic and the lumbar. When the patient bends over a little bit, there's no kyphosis or lordosis or scoliosis present. Her gait and balance appear satisfactory and steady. If you can just kind of walk back and forth here for me. She's steady, coordinated balance. There's no shuffling in her gait. The muscles appear and feel like they are a normal firmness. There's no hyper or hypotonia. So range of motion is just kind of move your neck around, open your jaw and your mouth, your shoulders up and down. You can do circles with your arms, wiggle your fingers, lift up your legs, both of them, bend your knees. If you can do circles with your ankles and move your toes. Okay, so the patient has full range of motion of all of her extremities. If I were to palpate the entire system, there should be no tenderness to palpation. There should be no swelling, warmth, or erythema of any of the joints. Okay, so neurologically, the tandem walking test, you're gonna walk forward in a straight line with from heel to toe, and then you'll do it backwards. So the patient is balanced and coordinated. The Romberg test, you're gonna stand with your feet really close together, kind of put your arms out, and then close your eyes. So I would observe the patient for 20 to 25 seconds, and there should be no swaying or loss of balance or falling over. Minimal swaying is okay. Pronator drift. So close your eyes again, but put your arms out with your palms up. And now I'll observe for any drift. There should be no drifting of the arms. They should stay, the patient should be able to hold them up steady even with her eyes closed. There should be no drifting or pronation. So coordination, let's do close your eyes and do reach out your arm and put your finger to your nose. Good, and do the other hand. Good, she has positive coordination, it's smooth, she's accurate with her movements. Let's do the same thing with your heel to shin. So put your heel and rub it up and down the shins. Other side. Again, the patient is having smooth, accurate movements that are coordinated. So I am going to check for sensation. I will take a sharp object. Does this feel the same on both sides? Mm-hmm. Does this feel the same on both sides?
Yes.
Okay, then the dull side, can you feel this on both sides?
Mm-hmm. Yeah.
Check the face. Okay, so the patient has positive sensation that is equal bilaterally. Okay, you can sit. We're going to check reflexes with our reflex hammer. Okay, first is patellar. So there should be equal bilateral responses, 2+ on both sides. We're going to check the ankle. You can bend your legs, cross them, and then you'd strike the Achilles tendon in the back. 2+ equal bilateral response. The biceps, I'll put a thumb on the bicep and strike this thumb. 2 plus equal bilateral reflex response. And the patellar reflex, the patient will stick her foot out and I will rub the bottom of her foot with an object. This is the patellar or the plantar reflex, and there should be no Babinski sign, which she does not have. Cranial nerve test. So the first cranial nerve is the olfactory nerve, which is testing for smell. So I'm going to ask the patient what this scent is of this candle.
Rose.
Rose. So she does have appropriate CN1 intact. The second cranial nerve is the optic nerve, so we'll pretend like we read off of a Snellen chart, and the patient would have 20/20 vision. She does have corrective lenses. So with my pen light, the ocular nerve should show perla, which is pupils are equal, round, reactive to light and accommodation. There should be no nystagmus, and all of her extraocular movements are intact. So follow my pen. Okay. Trigeminal is just palpating the masseter muscles, so open and close your mouth. So muscles are firm and symmetrical. The facial cranial nerve is just looking for any droop, so there's no drooping. The face is symmetrical on both sides. I'll have you raise your eyebrows. Okay, and then smile with your teeth, and then close your eyes and squeeze them really hard. Okay, so no droop is appreciated and the face is symmetrical. So the acoustic nerve is testing for her hearing, so I'll whisper a word to her and she will say what I whispered.
Cat.
So the patient's hearing is intact. When she's talking, that is a checking the glossal pharyngeal nerve, so there's no hoarseness in her voice, but I am going to have her open her mouth and say ah, and that's checking to make sure that the uvula rises at the midline when she vocalizes. And then I'll just have you shrug your shoulders up and down. Okay, turn your head side to side. And this is checking the spinal accessory nerve. She has 5 out of 5 strength, equal bilaterally. And then I'll just have you stick your tongue out. This is checking the hypoglossal nerve. The tongue is at the midline and it's symmetrical. And that completes our physical assessment of a female patient. Thank you.